are the times, particularly in the pastoral area and some of these rural areas in our county, where people, the only source of water is the water pods, water pans, and even the various dams that are within their reach. And because of the costs in terms of the power bills, for anywhere that there is a borehole that is pumped by power, then there is a monthly water bills, and which are more expensive to our rural communities. And particularly because our rural communities are poor, then they are not able to pay for the water bill, and therefore the alternative that they do have is to go to the water pods to water dams and water pans and get their water from there. And therefore many are the times that we used to have many cases of waterborne related diseases in our health centers, in our health facilities.
Lack of clean water is will affect will have an impact in terms of even financially and even productivity. If we look at even this patient, the sick person, this person who is now sick will lose maybe a week on medication and not doing anything. If you have a shop, you've closed because you're sick. So economically, that person will be affected, and subsequently it will translate even to the county. Remember, counties and governments don't make profit. They only collect money from taxes and all that. Then they plow that back. So if somebody is taken ill and is not able even to pay taxes and all that, and still not able even to fend for themselves, it becomes a huge economic baggage to both the government and even to the citizen.
Scarcity of water is there, the clean water is not available, and therefore we have to help the community to see that they drink clean water, which is safe both in schools and also in the households.
We currently have reached to 12,000 households, and 10,500 have really adopted the program, where they are able to treat water and they have adequate knowledge of water treatment, storage techniques, and harvesting. During that time, we were able to work with 100 schools. Those are being public, private, together the primary schools and the secondary schools, with the highest number being the primary school. This gives a population of around 10,000 plus pupils, which age between 5 to around 14. And the total population, it's almost 49,000, which also include the women and children.
Intervention that has been done through this program supported by Procter & Gamble through Bethel Network has been really impactful to the community of Laikipia. Because one, there's no other source of water. People have to drink this water, which is unsafe. So the introduction of P&G purifier to the community has done a turnaround for the health and livelihood of the community itself.
There is no one time any government, any community, any society, or any other organization will be able to meet all the needs of the people without partnership. And that's why even the national government encourages the PNP, that is a private-public partnership, to encourage other partners to come and partner to ensure that our people, our community, our citizens are having clean drinking water, whether they are in the towns or they are in the rural areas.